Hello everyone, my name is Sulema and I will be doing my case study on lobular carcinoma. What is lobular carcinoma? It is also known as invasive lobular carcinoma. ILC is the second most common kind of breast cancer. The first most common type is the invasive ductal carcinoma. This kind of carcinoma originates in the glands that produce milk called lobules and expands to other regions of the breast tissue. With time, this cancer can spread to the lymph node and it is possible to travel to other areas of the body. According to the American Cancer Society, more than 180,000 women in the United States find out that they have invasive breast cancer each year. Prevalence. Women at any age can develop lobular carcinoma, but with the increase in age, the risk of developing lobular carcinoma increases. The most common age is around 60 to 70 years old. There is research showing that the use of combination of estrogen and progestin hormone replacement therapy after menopause increases the risk of ILC. Presentation. The patient may notice thickening or hardening in the breast rather than a well-defined lump. There may be an area of swelling or fullness, a change of texture on the skin of the breast or nipple, for example, dimples, irritation, or a red area. The nipple may turn inward. There will be breast or nipple pain, abnormal nipple discharge, and lump on under the arm area, which can mean a lymph node. The following are the most common sonographic appearances of lobular carcinoma. It may appear heterogeneous, hypoechoic mass, has angular or L-defined margins, and it will have posterior acoustic shadowing. The diagnosis of lobular carcinoma involves a group of procedures, usually beginning with a physical examination of the breast. The doctor will be feeling for thickness or hardening of the breast, and they'll be feeling for swollen lymph nodes. A mammogram may be ordered, and ILC may be found, but it doesn't always show up well on mammograms. Ultrasound is also used, which seems to be more accurate in detecting ILC. MRI may be ordered to collect more information if there is a suspicious area seen on the breast. Lastly, a biopsy is performed if there is any suspicious in the previous testing modalities. The sample will be sent to the lab for testing and confirm or declining suspicious of ILC.
This button is released. This biopsy needle makes a forward move and takes a small piece from the mass. For breast biopsy, we first numb the skin and the region around the mass with local anesthetic injection. After this, the procedure will be totally pain-free. After local anesthesia, we make a small incision at the skin, and through this incision, we insert the biopsy needle towards the mass. When we reach the mass, we release the button of the needle and take a small sample from the mass. We generally repeat this maneuver to get multiple samples from different parts of the mass. After biopsy is completed, we send the samples for pathology. This button is
For treatment and side effects. For localized treatment, there are two options, either surgery or radiotherapy. Most women will have surgery depending on the tumor and spread. The patient will have either a lumpectomy or a mastectomy. With lumpectomy, the doctor only removes the tumor and some surrounding tissue. With a mastectomy, it will involve a removal of part or all of the breast and may include adjacent lymph nodes and muscle. With radiation therapy, a high-energy radiation is used to destroy cancer cells. With a systemic treatment, it includes either chemotherapy or hormone therapy. With hormone therapy, the amount of estrogen in the body is lowered and it keeps it from telling cancer cells to keep growing. Some of the side effects include hair loss, nail change, loss of appetite, nausea and vomiting, fatigue, diarrhea, fertility problems. In this case study of lobular carcinoma, an 83-year-old female presents with a palpable mass on her breast. Both a mammogram and ultrasound were performed to evaluate the palpable mass. Here are some images of the breast under ultrasound. You can see the lobular carcinoma with ill-defined margins and the posterior acoustic shadowing. Here you can see some images of the breast under mammography. The mass is difficult to see under mammography as it was explained before. There was no outcome provided on this case, therefore I cannot give an outcome on this specific patient. In conclusion, lobular carcinoma is a cancer that originates in the glands that produce milk. It is the second most common type of cancer. Women of older age run a greater risk of developing ILC. Biopsy is used for breast cancer diagnosis. The earlier it is diagnosed, the better the outcome. Follow-up appointments will be needed to detect a reoccurrence of cancer or any complications from treatments.